Hello, everyone. Today we will be talking about head and neck cancers. So, the word cancer itself uh, shakes us all off, and we are all really scared of the word cancer. What basically is cancer? We will be trying to understand what are head and neck cancers, how can we diagnose them early, what are the symptoms, how can we prevent them, what are the treatment options. So let's start with first discussing what is cancer. So cancer basically is uncontrolled growth of any cell in the body. So cancer practically can happen anywhere in the body. It happens when a cell divides uncontrollably, and it forms a lump, a swelling, which is called cancer. And cancer basic problem is it can develop anywhere in the body. It can also spread anywhere in the body. So that is why we are all worried whenever a cancer diagnosis is made. So head and neck cancers, they are a major problem in India. Almost one third of the cancers that we see in India are head and neck cancers. What do I mean by head and neck cancer? So basically, any cancer occurring either in the mouth, that is starting from the lips, in around the gums, or around the cheek area, on inside of the cheek area, and in the nose, the sinuses, and the part behind the nose and mouth, which is called the pharynx, also the voice box and the throat. So all these cancers come under head and neck cancers. So when we say head and neck cancers, we don't mean brain tumors, we don't mean eye cancers. These are not included in head and neck cancers. Head and neck cancer basically means cancers of the mouth, nose, and the area behind them, and throat, voice box. So let us see why do these tumors even happen in these areas? Why do cancer occur in this area? So in India, unfortunately, it is found that almost 80% of head and neck cancers happen because of the smoking and alcohol and tobacco consumption. So basically, smoking is another form of tobacco. Tobacco could be either smoke in the form of smoking, or smokeless consumption, as in the form of betel nuts, pan, gutka. So any form of tobacco consumption and alcohol consumption is found to increase the risk of head and neck cancers. So 80% of the head and neck cancers are due to this problem. So just imagine, it is such a simple way to avoid 80% of those cancers, just by avoiding any form of tobacco consumption, whether it is smoking, BD or cigarette, or consuming tobacco in the form of betel nuts, pan, or gutka, and avoiding alcohol, or probably consuming alcohol in moderate quantities, can prevent 80% of these cancers. So it's very unfortunate that this addiction is picking up more in the youngsters, and so every day we get to see many youngsters of less than 40 years of age being diagnosed with head and neck cancers. So one of the major causes is tobacco and alcohol consumption. Apart from this, there is a virus, the infection with HPV, that is human papilloma virus, is also known to cause head and neck cancers, more so oral and pharyngeal cancers. Not only that, poor dental hygiene, or someone with a sharp tooth which is constantly impinging on the cheek, all these are some of the risk factors for causing head and neck cancers. So one way to prevent is obviously avoid tobacco in any form, avoid alcohol, get your dental check once every 6 months. I think this is somewhat neglected in India. We all should encourage utmost dental hygiene. Someone with a long standing tooth infection, or someone with a sharp tooth which is causing so much pain, they don't go to the doctor immediately, and over the long term run, that can become cancer. So what are the symptoms? When is it that one should go to a doctor for a checkup? So symptoms like, let's say there is a sore in the mouth, there's an ulcer in the mouth which is not healing over a long period. Typically, a sore should just heal in a couple of days. But if a sore is not healing for a long time, let's say 2 weeks, then immediately consult your doctor. Apart from that, any change in the voice, difficulty in swallowing, all these are some of the other symptoms. Nasal bleeding, any form of nasal bleeding, constant throat pain are some other symptoms in addition to sore in the mouth. So all these are warning symptoms, and immediately one should consult a doctor for further checkup and evaluation. So how do we treat these? So first of all, diagnosis is made once a patient presents with any of the above symptoms, and a biopsy is done to confirm the diagnosis. Once a diagnosis is made, then the treatment depends upon the stage. Stage means how much this cancer has already spread. So early stage is when cancer is confined to the part where it is starting from. Like, let's say a cancer of the lip, which is just confined to the lip, it has not spread anywhere else, then that is considered to be early stage of the cancer. Advanced stage is when any of the head and neck cancers already spread to the neck, then that becomes advanced stage. Stage 4 is when cancer has already gone to other parts of the body, like lung or any of the bones, then that becomes stage 4 cancer. So the idea is to pick the cancer early. In early stage, the cancer is curable. Stage 1, 2, 3, there are different modalities of treatment. Sometimes more than one modality of treatment is used, and the cancer can be cured. But in stage 4, the cure is difficult, but still there are good treatment options to significantly prolong a patient's life. So in stage 1, 2, we generally treat with surgery, and in stage 1 and 2, we generally treat the patient with surgery. That is, wherever the cancer is, it is just excised, and depending on the histopathology report, that is, the biopsy is studied in detail, and if there are certain risk factors, then we give radiation also to the patient. Of course, the treatment depends on the site also. Like for cancers of the throat or voice box, it is not easy to just remove them. Sometimes we try to preserve the voice box by giving radiation therapy. So radiation is another form of modality which is used depending on the extent, again, of the tumor. Stage 3, we use both surgery and radiation to treat these patients. Coming to advanced stage where we cannot do surgery or radiation, then we have chemotherapy, immunotherapy, targeted therapy. All these are very promising, and they help patient to be able to control the disease and to be able to lead a life with quality of life maintained. So immunotherapy is the newer addition to our armamentarium in fighting these cancers. Immunotherapy basically works by enabling our immunity to fight against the cancer. Chemotherapy has certain side effects, but most of the side effects are manageable with the treatment options that we have now. So either chemotherapy will be used or immunotherapy can be used. Targeted agents are also available for treatment of head and neck cancer. Some of them are in injection form, some of them are in oral form. But like I earlier insisted, I think prevention is better than cure. So we all should spread the word. Tobacco is one major killer. It's almost responsible for 30% of the cancer related deaths the world over. So by encouraging people to give up tobacco, I think to a great extent we will be able to prevent these cancers. Of course, once the diagnosis is made, we have to encourage the patient to give up their habits, because it interferes with the treatment that we will be giving to the patient. So I think it's everyone's responsibility. Let's say if you're listening to this and if your friend is a smoker, or if your friend or a family member consumes tobacco, encourage them, help them in quitting. Do not shame them, but I think we all should help each other in giving up these habits. It's difficult in the beginning, but it can be done just by simply avoiding alcohol, tobacco, and maintaining good dental hygiene and being watchful of our own body, watchful of our symptoms, we will be able to pick these cancers in early stage and first of all prevent them altogether. And in case they do happen, then we can pick them in an early stage, and then with the available treatment options we can even cure these cancers. Also, FDA has now approved a vaccine for the HPV related oropharyngeal cancers. That is, a vaccine is now available, and this vaccine can be given between the ages 9 to 45 so as to prevent HPV infection, and thereby long-standing HPV infection can lead to oropharyngeal cancers. So by giving this vaccine, we are preventing infection and thereby preventing the cancer also. So I urge all my listeners, all the audience here, quit tobacco, quit smoking, quit alcohol, take care of your health, eat a healthy diet, moderate consumption of carbohydrates and sweets, and maintain a good dental hygiene, exercise regularly, and in case of any symptom, please consult your doctor immediately.